coating combination products.
These products contain
Hey! No! Get out of here! These products contain codeine combined with acetaminophen or another non-opioid. They're used for mild to moderate pain and sometimes for cough suppression. They should not be used in patients with respiratory depression, acute asthma, or in children after tonsil or adenoid surgery. Codeine works by binding to mu-opioid receptors in the brain. This reduces the perception of pain and suppresses cough. Common side effects include drowsiness, nausea, constipation, and dizziness. More serious risks include respiratory depression, dependence, and low blood pressure. Dosage forms include tablets and oral solutions. Codeine alone is Schedule II, but when combined and limited to a specific dose, it becomes Schedule III.
Buprenorphine.
Buprenorphine is used to treat opioid use disorder and chronic pain. It should not be used in patients with severe respiratory depression or acute alcohol intoxication. Buprenorphine is a partial opioid agonist. It activates opioid receptors but has a ceiling effect, which lowers the risk of overdose. Headache, nausea, constipation, and sweating. Respiratory depression can still occur, but the risk is lower than with full opioids. Sublingual tablets, films, transdermal patches, and injections. Because of the ceiling effect, taking more buprenorphine doesn't increase the high after a point.
Ketamine.
Ketamine is used for anesthesia, procedural sedation, and treatment-resistant depression. It should be avoided in patients with uncontrolled high blood pressure or a history of psychosis. Ketamine blocks NMDA receptors, which reduces glutamate activity in the brain. This causes dissociation and anesthesia, confusion, increased heart rate, and nausea, hallucinations, high blood pressure, and abuse potential. Injectable solutions and nasal spray formulations. Ketamine is one of the safest anesthetics for trauma patients because it preserves breathing reflexes.
Anabolic steroids.
They're used for low testosterone, delayed puberty, muscle wasting, and certain anemias. They should not be used in patients with prostate cancer, breast cancer, in males, or during pregnancy. Anabolic steroids bind to androgen receptors, increasing protein synthesis and muscle growth, acne, fluid retention, and mood changes, liver toxicity, heart disease, infertility, and aggressive behavior. Injections, oral tablets, and topical gels or patches. Steroids are Schedule III because of non-medical abuse in sports, not because they're narcotics.
Benspethamine.
Short-term treatment of obesity, heart disease, high blood pressure, and history of substance abuse. It's a stimulant that suppresses appetite by increasing central nervous system activity. Insomnia, dry mouth and nervousness, dependence, and cardiovascular risks. Oral tablets. Bensphetamine is chemically related to amphetamines. Short-term weight loss therapy, glaucoma, heart disease, and substance abuse history. It increases norepinephrine release, reducing appetite, anxiety, insomnia, and increased heart rate, dependence and heart complications. Immediate release tablets and extended release capsules. Phendimetrazine is a prodrug, meaning it's converted into another stimulant inside the body.